Today we're going to talk about the 10 danger signs if you're dealing with a narcissistic personality disorder, in particular a malignant narcissist. Stick around till the end because I need to talk about a few things in order to clarify what specifically I mean by malignant narcissist before I get to the 10 danger signs. But this is really important. I think a lot of people get into trouble in these relationships and actually can even get hurt. So there are 3 things to remember about narcissists in general. Not all of them are dangerous. So even though we're going to talk about danger signs, not all of them are dangerous. Not all narcissists have a diagnosed or diagnosable disorder. That's really important, and we'll explain that in just a minute. Somebody with untreated narcissism is very unlikely to be able to have a healthy relationship. That doesn't mean that because narcissism is treated, they'll be able to have a healthy relationship, but untreated, probably not. These terms get thrown around a lot, and we need to talk about the difference between narcissism or a narcissistic person versus something more specific and defined called narcissistic personality disorder. Narcissistic personality disorder is actually a disorder as defined by the DSM, which is a book we use to diagnose people in psychiatry. In the DSM, there are criteria, and you have to meet these criteria in order to be given the diagnosis of narcissistic personality disorder. There's a whole lot of criteria, but the main issue that separates the person who is a narcissist or has narcissistic tendencies versus somebody who has the personality disorder is that their tendencies have to have had negative impact on their life, or more specifically have caused significant distress to the person, or has to have had negative impact socially or occupationally or in some way like that. Now, it's important that to understand that the person doesn't have to have said, I'm a narcissist, or I want to see a psychiatrist. And I think that gets confusing to a lot of people. I've seen around on YouTube and in the internet that it's been said, oh, they have to say they're a narcissist and go get help. And that's not true. But they do have to have experienced some kind of distress, or they have to be functioning poorly in one or more areas. So what is narcissistic personality disorder or narcissism? These are people who have a tendency toward grandiosity, a bottomless pit of need for admiration, and they lack empathy for others. Those are key criteria. According to the DSM, this pattern needs to be rigid and inflexible and have occurred over a long duration of time. Now, again, that's the criteria in order to meet criteria for a personality disorder, but that doesn't mean you can't be narcissistic or have a narcissistic tendency without meeting criteria for the personality disorder. This slide gives you a list of the specific criteria, and what I've done is highlight words that really can specifically highlight what the issues are for people who have either the full-blown personality disorder or a tendency toward narcissism. People are grandiose. They think very highly of themselves. They have fantasies of endless streams of wealth, fame, almost superpowers. They think they're special, incredibly special, generally more special than anybody around them. They need admiration, continuous admiration, and this is generally because that grandiosity is hiding an internal sense of low self-esteem and terrible, terrible weakness. They are very entitled. These are the people who expect to be given special privileges. They expect to be treated with extra care and extra respect. They lack empathy, so they want what they want regardless of other people. They're envious often of other people and what other people have. They're haughty and arrogant. These are the people who are rude to waiters, rude to clerks, that sort of thing. At this point forward, I'm going to dispense with differentiating between narcissistic personality disorder and narcissism in general, because for our purposes, we're really talking about the impact these people have on other people and on the world in general. And in my opinion, it really doesn't matter whether you have the full-blown diagnosis or whether you're just walking around the world being a total jerk. You can still have a really negative and devastating impact on the world, particularly on relationships with loved ones. 3 things that a lot of people who are narcissistic have in common are that they are very highly sensitive to criticism. They are generally a very weak sense of self on the inside, low self-esteem, and that's what all that grandiosity is about on the outside. They may or may not be consciously aware of it, but that's what's going on. And very often there's a history of emotional abuse or neglect or trauma or rigidity or something in their childhood. So there are 3 types of narcissists, and again, this is not formal diagnosis. This is based on the research that's been done, which is fairly minimal, actually. We don't have a lot of information, and we need a lot more. But at this point, there are 3 general types of narcissists. There is covert narcissism, exhibitionist narcissism, and grandiose narcissism. Because I'm interested in getting to the point where I can explain the most dangerous aspects of narcissism, I'm most interested in the 3rd type. So very briefly, I will cover the first 2. Covert narcissist is sort of the Eeyore type. They are introverted, negative, self-effacing on the outside. Poor me, nobody pays attention to me, they don't know how great I am, the world is passing me by. If they only knew how wonderful I was, you know, I'd have all the acclaim and accolades that I deserve. They're angry, but they tend to be the guy in the corner. They're not out bragging unless you get really close to them. And then you get the sense that they have all this secreted away sense of greatness. But again, like all narcissists, they have very low self-esteem. These guys are toxic. They can be very passive-aggressive, but they don't tend to be violent. The exhibitionist narcissist is loud and braggy and obnoxious and out there with insisting on admiration and wanting constant validation, and is maybe the movie star type or the head of a company type, although maybe or maybe not, depending on his personality or her personality. This guy is clearly entitled and can be very exploitive of other people because of his or her lack of empathy. This is your classic narcissistic jerk. Hard to miss. This brings us to the third type, grandiose narcissism, which can loosely be broken up into adaptive and maladaptive. I want to make a point here, though. Human beings are not this clean. We can't really break people up into little tiny categories and expect them not to be messy with the boundaries. So really what happens is that you get people who are a little bit of this and a little bit of that, and we hope that we can categorize them enough to understand the bulk of their behaviors. So you're not going to have somebody who absolutely 100% fits into any of these categories that I'm talking about. However, if you do have a grandiose narcissist whose behaviors fit mostly into this category, you're dealing with somebody who's significantly more toxic and dangerous than either of the other 2 categories. So what is this? What is the grandiose narcissist? So we'll start with the adaptive type. These guys are CEOs of companies, they're politicians, they're successful, they're extremely charming. These guys make it work for them. However, they are extremely exploitive. They totally lack empathy. They will do whatever they need to do to make sure number 1 comes out on top. In that way, they can be very insidious. and very dangerous. Hang around with them long enough and you will see that they are insensitive, that they are impatient, that they are rude, that they are exploitive and manipulative. These guys are rude to anyone who doesn't matter to them. Kitchen staff, people, employees who are not significant to them, anyone who does not have an impact on their personal advancement. So everything they do with an agenda. And then we come to the maladaptive grandiose narcissist. And this is where we run into the most dangerous types of behaviors. So who is this guy? And I say guy, which is a little unfair. There certainly absolutely are women who fall into this category, but the fact is that more men, at least at this point in terms of the minimal research that's been done, more men do fall into this category than women. It's possibly an unfair, the hallmark here is aggression. These types of narcissists are aggressive and brutally exploitive. Walk around with an extremely exaggerated sense of self-importance. They are bossy, they are dominant and superior acting just about all the time. They are distrustful of professionals, primarily because of the threat professionals pose to their own sense of dominance and superiority. So they are likely to be dismissive of the opinions of doctors, teachers, other professionals. They are extremely sensitive to their own feelings. So very thin-skinned, very sensitive to criticism, and quick to respond with anger when they feel threatened. And this is where things can become scary. They are likely to respond with anger, hostility, physical and verbal aggression when they feel threatened. There is usually some kind of childhood neglect and or physical and or emotional abuse in the childhood of these individuals. The grandiose maladaptive narcissist may be completely out of society. This person might be a total loser, or they might be highly, highly successful. Neither of those extremes rules out that they have these characteristics. They may be very, very charming. They have a tendency when they get into relationships, to get into relationships with people who are vulnerable in some way. Oftentimes, if it's a man, they'll get into a relationship with a woman who is a great deal younger, who has less education, who has less power, who has less money, who perhaps is dependent in other ways. Maybe she has children, maybe she's isolated in some way. And slowly but surely, he will increase the discrepancy between them by isolating her further, by taking away her financial control, by having her not work, a whole variety of ways. Usually that sort of behavior is cloaked in the idea that he is caring for her, that he loves her, that he doesn't want her to have to work, for example. We'll discuss this more in another video, but this is the sort of insidious process that can occur. It is important, if you think you're in a relationship like this, to identify it and realize that you are. It is also important to set your expectations at a realistic level. These people don't change. They don't go to therapy and change. They don't go to marriage counseling and change. They don't go to group therapy and change. And they don't take medications and change. So it's really important to be realistic. The extreme end of all that we've talked about is the malignant narcissist. And this is a term that's been thrown around a lot lately. So I want to just clarify for you what malignant narcissism really means. It has actually been in the literature for decades and decades. What it really means is a person who has qualities of narcissistic personality disorder and also antisocial personality disorder. This is the most dangerous situation of all. If you think you're in a relationship with someone like this, whether it's at work, whether it's a friendship, whether it's a romantic relationship, whether it's in your family, you need to get help. Not all narcissists are toxic. And only some are dangerous, but these guys with the combination of narcissistic personality disorder and antisocial traits, these guys are the real thing. They are toxic and they are dangerous. Some researchers feel that they are the same as people with antisocial personality disorder. Antisocial personality disorder, very quickly, is basically someone who violates laws on a regular basis, who has absolutely no regard for the safety of others, and who has no empathy whatsoever. There's lots of other criteria. Some of them are listed here, but these guys are not people that you want to be in relationships with either. And when I say guys, I mean men or women. There are plenty of women who are also antisocial. So here we are, finally, the 10 signs that you absolutely need to get help or you need to get out. And generally, if you're in a relationship, again, work, romantic, friendship, family, whatever, with somebody who is narcissistic, most of the time you won't run into these symptoms and these signs, but sometimes you do. In my opinion, and I've been working with families and people, individuals for over 25 years, and I have seen, I think, everything. In my opinion, any one of these means you need to go. But I have to give a disclaimer, which is I am not offering medical advice. I am giving you an educational video. And if you feel you need help, you need to seek the help of a professional. Please listen to these signs. 1, you get manipulated. You get manipulated into a situation in which you are financially compromised, your health or safety is compromised, or you are legally compromised. So really, you will get manipulated if you're in a relationship with a narcissist, you will get manipulated. But if those things are happening, that is a really bad sign. That means they do not care about you. They are lying to you constantly, and then they are lying to you to cover up the lies. This is also known as gaslighting. So there's a lot out there on the internet. I'll make some videos about gaslighting, but if that's going on continuously, it's incredibly toxic to you. It is really, really bad for your psychological health, your emotional health, your spiritual health, your development as a human being. Pay attention. They are exhibiting continuously reckless behavior that endangers the safety of others. Any adult who's doing this, and when I say adult, I mean like they're not 13 anymore. Any adult who's willing to do that on a regular basis is somebody who will also endanger your safety and the safety of your loved ones, your children, whatever. That's not somebody that you want to continue a relationship with. Cause harm to somebody and won't take responsibility for it. And when I say harm, I mean real harm, like legal harm, financial harm, emotional, physical harm, and refuse to take responsibility. Again, an adult who does that is external. They have an external locus of control, is what we call that. And that's somebody who will do bad things to anybody, and you don't want to be around. He or she harms a child in any way. And I mean harms a child in any way for any reason. I don't care if that child, I don't know, spilled milk all over the kitchen or messed up the car or whatever. Harming a child is not acceptable, and anyone who will do that is somebody who will do other things that are bad. And when I say harm, I don't mean punish, I don't mean consequence, I don't mean limit set, I mean harm, and I think people know what that means. He or she takes pleasure in the pain of others or in your pain. There's a German word for that that I can't pronounce, but that's obvious. That's not something that's okay. And there are malignant narcissists who are also sadists. And that's very dangerous. He or she harms you or a loved one physically for any reason. There's an ongoing substance abuse problem. Unfortunately, I'm not advocating for leaving anybody anytime who has a substance abuse problem. I'll make videos on substance abuse. And I get it when people stay. I totally get it. I think substance abuse is an illness, not a moral failing. However, if you have a narcissist, particularly a malignant narcissist with a substance abuse problem, it's a recipe for disaster. And it's not something that can generally be handled by talking about it or processing or just loving the person a whole lot, those kinds of things. And really awful things can happen, and I've seen them happen. You feel afraid. If you feel afraid, you're walking on eggshells around the house, you're afraid that this person is going to explode or do something terrible, then you know. And the last one is if your spidey sense is telling you that you need to go, or you need to get help, or you need to talk to a professional, then do it. Here's some suggestions for what you can do other than talk to a professional, which I think is a great idea. Limit your interaction with the person as much as you possibly can. Accept that they're not going to change. If any of those 10 things are happening, this person is not going to change. Feel the need to confront them, wait until you find a safe way to do it. Talk to a professional, talk to your loved ones, and figure out a safe way to do it. It can be very dangerous, as I said earlier. Malignant narcissists in particular tend to have very, very thin skin, and they have a tendency to explode when confronted. Gather your support people around you, those who love you. And last, talk to a professional. Always, always. I shouldn't have listed it last. You should do it first. This isn't your fault. No matter how close of a relationship you're in with this person, no matter how long you've been in the relationship, it's not your fault. Narcissistic personality disorder and narcissism are very common, probably a lot more common than we even realize. Like I said earlier, these people can be very, very charming, very seductive, difficult to resist. So take care, breathe, take care of yourself. I'm Dr. Schwartz. Thank you for listening until the end. This is Psych Talk. I'll see you next time.